Hi, I'm Dr. Nicole Vane, the owner of Moonlight Beach Dental, a holistic and biologic integrative dental practice here in Encinitas. And today I wanted to talk about why is our practice fluoride-free? I would be shot in a dental society meeting if I said that we weren't using fluoride. I'd be accused of malpractice. So let me go into what it is about fluoride, why many dentists use it, and why we don't. So fluoride, the benefits with enamel were done based on research that was done in the 1920s, where they found that if fluoride incorporates into the dental enamel, it makes it stronger. That sounds awesome, right? So people think of it as like this super shield that it creates on your teeth, that it's just gonna make your teeth so strong, and if you have a lot of cavities, it's only because you don't have enough fluoride, right? That's actually really, really wrong. So in the 1960s, as a public health effort, most states integrated fluoride into their water supply. Well water actually had a lot, too much, and it was causing something called fluorosis, which is a weakening and modeling of the enamel. Some people had this really brown, chalky, weak, discolored enamel from having too much well water. Now, in the public water systems, they were putting in 1.2 parts per million. You're like, okay, well, that sounds great, right? And the whole point was to give underserved areas access to fluoride so that the poorer people who are of a higher incidence of decay would be getting less cavities. Well, that sounds amazing. Except the way fluoride's extracted is it's actually from fluorine, which is in soil fertilizers. It's actually a pretty toxic element. That's a whole nother subject. But if you are like, well, I don't even drink water, I only drink bottled water, it's not usually extracted from bottled water. And I'm gonna go get a Starbucks. Guess what? They use fluoridated water. I'm gonna drink juice from concentrate. Guess what? It's made with fluoridated water. I'm gonna have this dehydrated item. I'm gonna eat my dehydrated oats and make some oatmeal. Guess what? That has fluoride in it. It's pretty crazy, right? So now, every time you brush your teeth, there's fluoride in it. You come to the dentist. I'm gonna give you a fluoride treatment. What I'm seeing now is a profound incidence of fluorosis. All my young patients now are getting this weird mottled enamel. And we're in a pretty affluent area here that's very healthy. So it's kind of odd to see something that should be in a poorer community with well water that doesn't have access to care. It's the opposite of what we should see. And to me, it's correlated with an overabundance of fluoride. So how do we avoid it? One, we don't have fluoride in any of our water bottles. We don't use city water here. All of our dental lines are with ozonated distilled water is what we use when you have your cleaning or when we're drilling and the water comes out of the drill. Now, one other reason I'm passionate about this is I have thyroid disease. I have Hashimoto's thyroiditis. Fluoride, before the advent of the modern technique we use for treating Hashimoto's or other thyroid disorders, is we now use a synthetic thyroid hormone to supplement the thyroid. Well, before that was around, guess what we used? A daily dose of fluoride to suppress the thyroid. So now people are getting all this fluoride, and it's really correlating with the increase in thyroid disease that we're seeing throughout the United States. It's estimated 28 to 60% of the population has some sort of thyroid disorder, even children. So I'd rather just be safe than sorry, and people can choose however they want to get the fluoride. It's around you everywhere. I recommend a fluoride-free toothpaste. We have some natural ones here in the office that I can show you, and definitely no supplemental fluoride treatments. My approach is let's address the source. Now, the Western diet is very starchy and sugary, and what that leads to is highly acidic saliva, and what that causes is decay. So if you're a patient in this office and you have a ton of decay, you're like, I've always had bad teeth, my mama has soft teeth, or it's really just because I had soda 4 years ago and I gave up soda. It's actually from our diet. And so if you're willing to have the conversation, or if you want to explore why you're getting so much decay, that's something I'm more than happy to help you with. But I'm not going to mask it by giving you high doses of fluoride, which can have other harmful side effects. So our technique's a little different here at Moonlight Beach Dental, but I really hope it's something that you want to explore.